This is my presentation on lead exposure. Lead is a widely distributed metal in the environment, and it is often used in paint, in homes, toys, but can also contaminate air, water, and soil, which ultimately affects us. So why does this problem exist in society? Lead is a highly toxic metal and a strong poison, and excess exposure to it leads to buildup in our body, which could negatively impact our health. Once the body is exposed to lead, the damage cannot be reversed, only treated. And this problem exists mainly in young children, especially those who live in households exposed to lead-based paint. Approximately 2.6% of preschool children in the U.S. had a blood concentration of larger than 50 ppb. And children are more likely to be affected by lead exposure because they absorb lead at a higher level than adults. This problem is also prominent in socioeconomically disadvantaged groups since regulations are not strictly enforced, so people are exposed without their knowledge. How does this disease happen? This disease happens from long-term exposure to lead, which are prevalent in older homes or toys from outside the U.S. And lead enters the body through the respiratory and digestive system, and it is ultimately released into the blood and distributed through the body. Where does this disease occur? It occurs everywhere, but it occurs more often in areas where people reside in pre-1978 houses because they contain paint with higher lead concentrations. And it also happens in areas where adults work in places that involve lead. The etiological factors are age, because infants and young children absorb lead more easily and sustain more harm, so they are also more likely to suffer from the disease pica, which is when children eat non-food items. These children might chew paint that flakes off a wall, and their hands are more likely to be contaminated with lead dust, since they may crawl on their hands or they may be playing on the floor. And pregnant women are also at risk of lead exposure since they can pass on the high lead levels to their unborn children, leading to spontaneous abortion or complications with a newborn child. People who live in poor ethnic communities are also at risk because substandard housing is common, and many of these have lead coatings all over the house. Job is also another factor. People who work in industries where risk of lead exposure is high, such as construction, auto body repairing, etc., are more likely to be exposed to lead. And some future risk for the community in the future is that many people will be suffering from tragic symptoms such as developmental delay, learning disabilities, and also high blood pressure. And these problems could be prevented, and having a large number of people suffer from it is very saddening. Lead exposure can also contaminate air, water, and soil, and this is already prominent at Flint, Michigan, where there is a crisis for clean water due to lead contamination with pipes. So how should we solve this problem? The first approach we can follow is to eliminate childhood lead poisoning by creation of more lead-safe homes for low-income families with children, since they are at greatest risk of lead exposure. An existing law is Executive Order 13045, which focuses on improving environmental health and safety for children. Another essential and best approach to eliminate lead exposure is to prevent it from happening in the first place. We could regulate lead paint and educate the public on the harm of lead. We could also ban lead-based paint so that the problem does not spread, and promote lead testing for children who may live in risk areas so they are able to catch the disease before it becomes more serious and harmful. A cultural example I'll be talking about happened in Uruguay. A decade ago, dozens of lead poisoning cases in children surfaced. The government worked quick to combat the problem, which was prevalent in poor neighborhoods that had contaminated soil. They also collaborated closely with other groups and isolated the source of lead contamination and relocated families in affected areas to other homes. They also passed laws that enforced strict building regulations and eliminated future risks of lead contamination. A historical example I'll be talking about is based from California to Pennsylvania, where local leaders and health officials created very strict measures that protected children from toxic lead by enforcing screening and ensuring that the homes people lived in were not harmful. They also built programs that helped the community in need. So what does literature say we should do? Literature say that the main approach we should be working towards is chelation, which is a treatment that uses chelating agents to convert lead ions into chemically and biochemically inert forms that can be excreted from the body. And many people in developing countries do not have access to these treatments, so expanding the availability of it will help people in need. It is also helpful to renovate homes that are tainted with lead and provide communities with lead tests. My opinion is that the best way to prevent any lead exposure cases from appearing is to prevent the problem from happening in the first place. This can be done by enforcing strict laws about the standards of homes and focus on helping people in developing countries since they are the ones that are most affected by it. It is also more effective to find the source of the problem and try to fix it from there. And these are my references for my presentation. Thank you.